Hello, my name is Katrina Sand, and I am one of the occupational therapists with CentraCare Home Health. I'd like to welcome you to this video presentation today, where I will be discussing the essential role that home health services can play in helping individuals living with dementia continue to live in their homes as safely and as independently as possible. Throughout my career as an occupational therapist, I have worked with many individuals and their families who struggle to really understand the disease and find ways to support the individual living with dementia. In the modern world of healthcare, home health providers are uniquely positioned to bring high-quality, personal health care to individuals in their homes. CentraCare Home Health is proud to serve all of central Minnesota in this way. During this video, I will offer a brief introduction to dementia and define what we mean when we use the word dementia. I will also discuss some of the common concerns or areas of change that impact the lives of people living with dementia. And finally, I will discuss the ways in which CentraCare Home Health and Hospice can meet the needs of our central Minnesota neighbors who are living with dementia. Before we go further, it's important to note that the information in this video is not intended to diagnose or treat any medical conditions. If you have concerns about yourself or a loved one, please discuss those with your doctor. This video is intended only to be informational and perhaps serve as a good conversation starter between individuals living with dementia, their care partners, and their medical providers. I'd like to begin by talking about what we mean when we use the word dementia. Dementia is an umbrella term, meaning that it actually refers to multiple different medical disorders. All of these conditions are characterized by structural changes within the brain that can have a significant impact on a person's physical abilities, their cognitive abilities, and their social abilities, among others. These structural changes in the brain impact the way that the different areas of the brain communicate with one another and share information. The rate at which these changes occur, or the way in which the changes present themselves, is often unique to the individual, but there are certainly general patterns that have been identified by researchers and healthcare providers. Some of the more common types of dementia that you may have heard of are Alzheimer's disease, Lewy body dementia, and vascular dementia, but there are several others. Altogether, the CDC estimates that 5.8 million Americans are living with dementia, with Alzheimer's disease representing approximately 60 to 80% of all cases of dementia. As baby boomers continue to age, those numbers will likely go up. While each type of dementia has unique features that differentiate one from another, for the purposes of this video, I will be using the term dementia to describe the common themes and concerns that individuals living with all the various types of dementia often experience. Now that we have a basic understanding of the term dementia from a medical standpoint, I'd like to spend a little bit of time talking about the changes that we see in the bodies, minds, and lives of individuals living with dementia. As I mentioned previously, the ways in which these changes manifest often vary from person to person, but there are certainly common themes. When an individual is experiencing functional changes due to dementia, we are often looking for changes in patterns that occur over long periods of time. We all have bad days now and then where we don't quite feel like ourselves or we don't think as clearly as we normally would. And that is not what we're talking about here. With dementia, we are looking for patterns that emerge over time, become repetitive, and are a clear deviation from what the individual considers normal. In other words, it's much more than simply having an off day. Individuals living with dementia may experience physical changes in their body related to their walking, their balance, and their likelihood of having a fall. For example, an individual may begin to shuffle their feet when they walk, or they may become increasingly reliant on the walls or the furniture to maintain their balance, or they may begin to experience falls that become more frequent. It's important to rule out other physical problems that may cause these issues, such as joint pain that affects walking. They may also experience physical changes related to loss of bowel or bladder control that are not related to another health issue, such as a urinary tract infection or an illness that may cause intestinal issues. Individuals living with dementia may experience changes in social participation and involvement, such as withdrawal from beloved family gatherings. For example, An individual may become increasingly withdrawn at a family holiday or event and may struggle to participate in conversation because their brain is no longer able to keep up with the pace of the conversation. This behavior is sometimes masked by attempts to tell jokes or change the subject in conversation in an attempt to prevent others from noticing the person's difficulty participating in the current topic of conversation. Individuals living with dementia may experience behavioral changes. Clinically, I found it interesting that when individuals with dementia are portrayed in movies or on TV, they are often shown to have significant agitation, anger, and anxiety. While these behaviors certainly can and do manifest for some people living with dementia, particularly in the later stages of the disease, there are many people whose behavioral changes are much more subtle and intermittent. The individual may experience brief periods of anxiety, possibly related to a certain event or some other trigger. They may experience brief periods of confusion or a loss of sense of reality, only to quickly regain it for a period of time. These fluctuations in behavioral patterns can be stressful for the individual themselves as well as for their care partners. When we talk about these behaviors, we are, again, looking at overall changes in the patterns of a person's behavior, not just a bad day. Additionally, an individual living with dementia may experience changes in their ability to maintain body hygiene that is a clear change from their lifelong preferences. For example, perhaps an individual has always bathed daily. They've always appeared neatly groomed, and they've been known by their family for always wearing coordinated and neatly matched clothing. Over time, perhaps family or loved ones begin to notice that the individual's clothing appears soiled. Outfits are mismatched, and the individual does not seem to notice their own body odor or disheveled appearance. This establishes a pattern of change and is an indicator that the person is no longer able to maintain their personal hygiene at a level that they've maintained for their whole life prior. The individual may have difficulty managing new or complex information. This particular change can impact many areas of someone's life. In my clinical experience, most often my patients are struggling with managing their finances, managing their medications, especially if they are prescribed a new or unfamiliar medication, and managing their healthcare-related paperwork, such as bills, Medicare or Medicaid paperwork, etc. Some individuals with dementia may also be at increased risk of being taken advantage of by identity thieves or scammers, as it becomes increasingly difficult for the person to detect the legitimacy of the information they receive. An individual with dementia may experience issues with malnutrition or changes in their eating habits. As an example, the person may experience significant weight loss due to loss of appetite or loss of interest in their favorite foods. The individual may forget or miss meals, or may even develop swallowing issues that cause the individual to choke. These can be the result of changes in the brain that impact its ability to control the muscles we use to swallow. Individuals living with dementia may begin to misuse everyday, familiar items. An example of this would be an individual who picks up the television remote when attempting to make a phone call and is unable to realize their mistake and correct it by switching to the telephone instead. This can potentially be dangerous, as the person may not be able to operate the phone in an emergency situation. Another example would be an individual who has always made a pot of coffee in the morning, but is now unable to operate their usual coffee pot. Use of kitchen appliances or other household tools is potentially hazardous, as the individual is at increased risk of injuring themselves when trying to figure out how to operate the appliance. As we talk about these changes in a person's ability to care for themselves and engage with the world, it's important to note that this list is not exhaustive. There are certainly other changes that an individual living with dementia may experience. The changes I noticed previously and the examples I described may appear somewhat differently in real life, depending on the individual's lifestyle, personal preferences, their support systems at home, etc. But I hope that discussing these changes and providing examples that are somewhat common serves as a helpful way to begin a discussion with the individual living with dementia as well as their care providers. In my experience as an occupational therapist, many of my patients may notice some of the functional changes I just described in themselves or in a loved one, and it leaves them wondering how to start the process of getting help. If you are watching this because you have concerns about yourself or you are concerned about a loved one of the best places to start is by setting up a visit with the affected individual's primary care provider. And this is typically who you would think of as your regular family doctor or provider. A primary care provider is an excellent first resource to answer questions and guide care, in addition to making sure the individual is up to date on routine medical care like their annual physical. If, for example, the individual living with dementia has been experiencing nutrition issues, or skin breakdown due to changes in body hygiene, or side effects from their medications, visiting their primary care provider is a great way to get the individual the care that they need in that moment, as well as help the individual access any specialty services that they may benefit from in the future. Specialty services may include imaging, such as an MRI, CT scan, or X-ray, visiting specialized medical providers such as neurology or behavioral health. Primary care providers can also refer an individual to CentraCare Home Health and Hospice to bring extra assistance to that individual in their home. When an individual living with dementia is referred for CentraCare Home Health services, I truly believe that it is an essential step in promoting that person's independence and safety in their own home. At CentraCare Home Health, we are fortunate to have amazing clinicians literally at the doorsteps of our community members and neighbors, from Big Lake to Long Prairie to Paynesville and everywhere in between, rain or shine, 40 below or 110 above. I'd like to spend some time highlighting the wonderful services offered by our team for individuals living with dementia, beginning with CentraCare Home Health's incredible nurses. Our teams of registered nurses are able to work one-on-one with individuals and their family members to provide help with a number of things. These include management of new, chronic, and complex health issues, including pain management. As an example, if the individual with dementia is managing a chronic condition such as diabetes or heart failure and is also recovering from an acute illness like pneumonia or the flu, CentraCare Home Health nurses can provide close monitoring of all of those conditions and how they may impact one another. Our nurses provide help with medication management, including teaching medication safety, teaching individuals and their families proper medication setup, and monitoring the side effects of any new or recently started medications. This is particularly beneficial for individuals who are starting a new medication or are taking a complex and high-frequency medication for a short period of time, such as an antibiotic. Our nurses can provide training on the use of medication management devices, such as locking medication dispensers. These devices provide a safe and handy way to ensure that the individual's medications are administered correctly every day of the week. There are many different styles and brands of these devices, but most of them allow medications to be filled for a week or two at a time, and then the medication dispenser is set to alarm at the preferred hours of the day, for example 7 a.m. and 7 p.m., to indicate to the individual that it's time for them to take their medications. Our nurses provide coordination of care with specialty providers, which means that they can report any relevant concerns directly to the specialist and also assist patients in understanding information or instructions that they receive after meeting with a new specialist. Our nurses at CentraCare Home Health provide education to individuals and their families on dementia as a disease, including typical symptoms, disease progression and what to expect, and that includes managing dementia-related behaviors. CentraCare Home Health nurses also do a wonderful job of working with the care partner or partners of the individual living with dementia to manage the unique demands and challenges that can occur when you love and care for someone with dementia. They can provide a listening ear and also teach care partners strategies for successfully engaging and caring for the individual with dementia throughout the disease process and for the person's entire life. Finally, CentraCare Home Health offers a 24-hour-a-day, 7-day-per-week nurse triage line to our patients, so that if the individual ever has a medical concern, a CentraCare Home Health nurse is just a phone call away. In addition to our wonderful nurses, CentraCare Home Health is proud to offer the services provided by our home health aides. These are specially trained and certified aides who provide individuals living with dementia assistance with self-cares on a weekly basis in a dignified and respectful manner that is tailored to the needs of that specific individual. These services typically include bathing, toileting, grooming and hygiene, and dressing. The aides work with individuals at all levels of physical and cognitive functioning and truly provide compassionate, personalized care to help the individual living with dementia look and feel their best. In partnership with the CentraCare Medical Alert Service, CentraCare Home Health staff frequently assist patients and their families with enrolling individuals in the CentraCare Medical Alert Service. These alert pendants can be used in the event of a fall or other medical emergency to alert appropriate personnel and quickly get the individual the assistance they need without the need to dial a phone. Individuals living with dementia and their care partners often have needs related to community resources and coordinating the individual's care. CentraCare Home Health has our own team of dedicated social workers available to assist individuals living with dementia and their families. Our social workers are truly incredible advocates for our patients who can help them navigate the often complex and confusing medical and legal worlds. CentraCare Home Health's social workers assist individuals and their loved ones in completing necessary legal or medical paperwork such as advance directives or Medicare and Medicaid paperwork, as well as assisting individuals with applying for additional appropriate services at the county or state levels. Our social workers are knowledgeable about the communities they serve, and they know the resources that are unique to Monticello or Sauk Center or St. Joseph, and can guide individuals and their families to services that are in their backyards, not across the state. And finally, our talented social workers often serve as liaisons between the individual and their family and the medical providers, community resources, and government entities so that our patients know they are not alone in their journey. In addition to all of the wonderful services I just discussed, CentraCare Home Health offers multidisciplinary therapy services in the home. I am so fortunate to be able to work with talented and passionate, board-certified and licensed physical therapists, occupational therapists, and speech therapists. The therapy teams at CentraCare Home Health can provide recommendations on home safety modifications, which could be as simple as shifting a piece of furniture to the left or to the right to prevent a tripping hazard, or as complex as advising on a total bathroom renovation. We provide training on adaptive techniques and equipment to allow the individual to care for themselves as safely and as independent as possible. Oftentimes this is as simple as using a simple piece of adaptive equipment in the bathroom, like an appropriately sized shower bench, or spending some time teaching the individual a safer way to navigate the stairs in their home. This can make a significant difference in the individual's safety and their ability to continue living in their home. Our therapists can also provide training on the use of assistive mobility devices, such as a cane, walker, or customized wheelchair. CentraCare Home Health therapists are trained to assess and provide properly fitting equipment that is appropriate for the person's physical abilities and needs, as well as their home environment. Our therapists are able to instruct and guide whole body strengthening, balance, and gait or walking training to reduce risk of falls and help individuals living with dementia be able to navigate their homes and communities safely. Our therapists can administer a variety of well-known, objective, but simple cognitive assessments in the home to help determine the level of cognitive change an individual is experiencing and offer recommendations for care to the individual and to their care partners, such as if the individual with dementia would benefit from some supervision or assistance from another person in the home, and how much or how often is appropriate. Based on that information, we can then provide instruction on strategies to compensate for memory impairment or other cognitive concerns, such as difficulty operating household appliances and electronic gadgets, or keeping track of medical appointments. Our therapy team, particularly our speech therapists, can assess any swallowing or feeding safety concerns. They work in conjunction with our nurses and the individual's medical providers to provide recommendations for dietary changes as needed to ensure that the individual living with dementia is able to maintain proper nutrition for their overall health and well-being. The services provided by CentraCare Home Health for individuals living with dementia are person-centered and unique to their lifestyle, living environment, and community. It is my sincere hope that the information presented here today helps to shed some light on the challenges that individuals living with dementia face in their own homes, as well as the services available to them from CentraCare Home Health to alleviate some of those issues and improve their safety, independence, and success at home. I think I can safely speak for everyone at CentraCare Home Health when I say that we truly believe the best place to be is at home, and we are passionate about helping individuals living with dementia and their care partners achieve the quality of life they want and deserve. Thank you so much for joining me today.